Good afternoon, everyone, and welcome to our panel discussion. We're on shaping the future of healthcare and navigating healthcare policy changes in an election year. I'm Dr. Stephanie Keating. I am a full-time faculty at the School of Nursing, as well as an acute care nurse practitioner. My colleagues, this is Dr. Amy Smith. She has also is a full-time faculty member at the School of Nursing. Her specialty is in emergency and a safe nurse. And my other colleague is Dr. CCD, also a full-time professor at the School of Nursing, and her specialty is in psychiatry. So, Dr. Smith, can you start us off with a brief overview of the historical context of healthcare policy in the U.S., particularly in its role in election years?
We definitely have this intersection of healthcare policy and politics. It goes all the way back. If you think historically back to Theodore Roosevelt, he had a push for national health care, which clearly, as we all know, has never actually taken hold here in the United States. And it's always been a pivotal issue in an election year. Lots of things come up when you're thinking about the elderly, when you're thinking about LGBTQAI plus communities and women's health, all different types of things. And every cycle, every election year, these different types of issues come up. But we've had milestones too, right? 1965, we had the milestones of Medicare and Medicaid, which is obviously something that we still use, and every election year it comes up. Are we going to be able to keep supporting these programs? And that would really put many, many people, hundreds of thousands of people without health care in this country. And we already kind of have an issue with that. In the 90s, Clinton put forth a different type of health care policy, which unfortunately was not successful. And then most recently, of course, Obama's Affordable Care Act, and that started in 2010. So it always brings this renewed focus on healthcare, when really healthcare should be at the forefront of everyone's mind all the time, and not just because I'm biased because I work in healthcare, but it is an issue if you think in your families even that healthcare becomes an issue for different people. But this year it's very polarizing. We have a lot of things like access to abortion, especially since the overturn of Roe v. Wade. Gender affirming care, and that differs from state to state, not just with, it's not a kind of across the United States issue, it's an individual state issue and county. Mental health services, which Dr. D can definitely tell us more about. So, you know, I think that these different types of issues kind of show the trends and the way and the healthcare needs of our nation. But I think it's really crucial that we, specifically as healthcare professionals, that we have to remain informed about these issues so that we can pass that information along to our patients.
Thank you, Dr. Smith. Dr. D, do you want to highlight any healthcare policy changes that we are facing?
Yes. So as Dr. Smith was saying, that gender affirming care, I think, is especially at the forefront, especially amongst transgender youth. You know, as some states are trying to restrict access to transgender and gender affirming care, some states are then fighting to protect it. It's really created a patchwork across the nation, which can be really confusing amongst healthcare providers. Regardless of, you know, our personal belief, providers now face legal and ethical challenges that prior they did not have to face. An example is in a state that restricts access to gender-affirming care, is a provider required to make a mandated report for a transgender youth and family seeking that care. It really becomes an ethical issue as well as policy problems. Reproductive health is always on the forefront, I feel, in every single election. Since the overturn, as Dr. Smith said, of Roe versus Wade, you know, abortion is no longer a constitutional right. So now states are determining their own policies, which has really created the same thing. It's a patchwork across the country. In some states, they would say it's a desert of no reproductive health care needs. And what it's creating is it's creating medical refugees. So people who are then crossing into other states to receive the care that they can't get in their own state, which then is putting an economic burden on those states, pending what their healthcare coverage is or if they're going through their healthcare coverage. So that also is causing quite an issue. A good example too, it was like very recent, on September 12th in North Dakota, the state court struck down the state's total abortion ban, saying that it was unconstitutional. So the state court said, you can't say that. We're going to continue. However, by that time, all of the clinics had already been disbanded, and now there's no infrastructure to rebuild them again. So now all those individuals in North Dakota, although they now can receive that care, they have nowhere to go. And of course, mental health. I mean, always at the forefront as well, especially in the last few decades, with everything that's going on in the news. It brings up to issues of reimbursement. I think that is where the primary problem is. It's a lack of healthcare providers and then a lack of payment of those healthcare providers. I'm sure many people know people who have sought mental health care. I work in the emergency room as my fun sort of thing that I do for my clinical work, and individuals really struggle to find providers that take their health insurance, and it's unfortunate, but the majority, I do not have a personal private practice, but the majority of colleagues that I know that have private practices do not take health insurance, which is ironic, because then you're like, wait, what? And it's because of the reimbursement rates, because of the overhead costs, the office space, the costs to then submit everything, the secretarial work, the EMR. It all costs money, and they don't make their ends meet, and they sort of become in this limbo of, do I become like a pill mill where I have to see 30, 40 patients a day in order to make ends meet? Or do I take, private pay, where I can feel I can give a quality of care to those 6 patients? I mean, that's their individual decision that like I said, I don't have a private practice, so I cannot attest to.
I think that also creates, lack of access to care for those people that don't have health insurance or maybe live under the poverty line, or students who maybe are being supported by their parents but don't have full coverage, right? So now it's like, I know you need mental health care, but I can't give it to you because you can't pay me. Goes away from really treating the human spirit, the human condition, and goes into this money thing. And I also do not have private practice because I'm an emergency medicine NP, and I wouldn't want that because I love that we see every person that walks through the door. I want to care for those people that are unable to care for themselves. That's why I became an NP. And also the reimbursement, as Dr. D was talking about, is less for nurse practitioners than it is for DOs or MDs. DOs are doctors of osteopathy as well as medical doctors. And so they will get 100% reimbursement, so worth it for them. But a nurse practitioner, although we have full practice authority in New York State and can see our own patients independently, we only get 80% of what they would normally pay. So then that becomes a hardship on the healthcare providers, which then trickles down to patients. So I'd rather let somebody with money deal with the money issue, while I can just see patients and take care of them and, make them happy and healthy.
Yeah, so it's becoming, a very large issue in this country in terms of figuring out the reimbursement rates so that care can be provided.
Yeah.
Other issues as well include things like telehealth. Telehealth is hot, it's big, but it's the same problem. Although we can extend the care to rural areas, it still brings an issue of reimbursement and of those rates that those people who are still practicing privately are still doing the same thing except via telehealth. Other issues include that I know Dr. Smith can talk to quite a bit is, extending of postpartum Medicaid coverage due to the issue of morbidity and mortality of postpartum individuals.
The United States has the highest incidence of morbidity and mortality in pregnant women and postpartum women in all of the developed countries. And that just seems crazy to me, right? Because we are supposed to be, the number one superpower and have all these resources and stuff. So why are our pregnant women and our fetal demise so high? It should not be the case. Unfortunately, it is. So part of it is lack of access, right? There are a couple of very good documentaries out there, especially speaking about the African American communities that don't have access to care, and they're not getting, good pre-pregnancy planning. They're not getting good intrapartum, care. They're not getting good postpartum care. There's high incidence of infection, being unable to feed their new babies or have housing. And so it's this kind of trickle down thing. And as well as poverty, increased rates of C-sections, and a lot of times, and I don't want to be like cynical and glib, but a little bit I'm cynical and glib, is that it's the docs can charge more money to do a C-section on somebody than just deliver your baby naturally, right? So now you're talking about a major abdominal surgery, and if these women don't have postpartum care, high increased rates of bleeding, infection, and all other kinds of things like that. So, when we think about maternity and what happens to the people in our country, it's actually pretty bleak situation currently in this current climate.
Can you discuss more in terms of that, the implications of the overturning of Roe versus Wade and access to increased maternal care? And I'm not sure if everyone knows, if you can just give a little back about what the overturning of Roe versus Wade actually meant.
Yeah, so Roe versus Wade, so that gave us the right, as those of us that are female or female identifying, to be able to get an abortion if needed or if wanted. Freedom over our own sexual health, right? And so that, you'll see a lot of like funny T-shirts and say like, if you don't have ovaries, then stay out of mine and stuff like that. But really, that's kind of the crux of the issue, is that people making these decisions for other people, they're not affected by this type of care, right? And so we did have a right in this country to be able to select our own health care that will affect our bodies. And now what's becoming is, back before Roe v. Wade came into as a law, women were dying because they were looking to get abortion services, and they were going to people who are not physicians, who are not in healthcare. They would call them back alley abortions. I'm sorry, I'm not fun at parties because I talk about really weird things, but this is super important, right, in our political climate. And as you're going through life and you're becoming professionals and you're getting your education, it's important to know these things, right? And people were dying. They were dying of sepsis. They were, it was practically murder. With not even medical instruments, coat hangers and other kinds of things to force a female to abort a fetus, so that was really dangerous. Roe v. Wade helped us kind of have that good medical care that you can go into a clinic or a private physician or whoever, offered those kinds of services to be able to get health care that was appropriate, safe, monitored, right? So that you're not just on your own bleeding somewhere in your bed. It sounds really gruesome, and it was in fact very gruesome. Here we are back, and as Dr. D alluded to, people coming for medical refugee purposes to different states, because each state has a different level of how they kind of pulled back on services. And she was talking about, what was it, North Dakota, right? All those clinics were closed basically because this happened, and they made it illegal for healthcare providers to be able to provide these services. So now, not only were the people that were seeking these services at risk for getting arrested, so are the healthcare providers for providing these services. So now it's created a climate where, as a healthcare provider, I want to give safe healthcare to people. However, do I want to go to jail for that?
And going on that, I was going to say as well, it has brought fear to healthcare providers. In addition to reproductive rights, IVF. So alongside Roe versus Wade being overturned is those who seek IVF, the question of unused embryos.
Yeah.
What do you do with those? Are they life? Are they not life? There has been a lot in the media about physicians and other individuals in reproductive health fearing, going to jail or being arrested or getting their license taken away in states where it is considered life, but and testing and doing those things. So really what a lot of the reasons for IVF now come into question, where then providers just are afraid to even give care.
Yeah, absolutely.
Can you discuss what are some strategies that we can employ to advocate for medical care of the communities, especially regarding LGBTQAI plus health, gender affirming, abortion rights?
I think that, and not just because I am an educator, but I think education is key, right? And it's really key for you. If you think about it, you need to know your rights. You need to know what's available to you, what is legal, what is not legal, where you can get this kind of care, and the support that you need to be able to live the life that you choose. Because this is still America, and we do have freedoms. Still have freedoms, and we want to keep it that way. We want to have that choice. And if your choice is you don't believe in abortive services, that's your choice, and that's great, and that should be celebrated, and it should be protected. Just like if you choose to do that, to have an abortion, or you choose not to have a family, or maybe you're unable to have a family and you choose to get IVF, you should have the right to be able to store your eggs, have them fertilized, maybe for a later time. Maybe you're sick right now, hopefully not, and you want to wait until you're better. I've seen lots of young people that end up having cancer. They want their treatments to be over, and they still want a chance of having a family, right? So it's really important to educate the public, educate yourselves. I try to keep up on the latest and greatest. Are politics my favorite thing to discuss? They're not. They're not my favorite things. It's always an uncomfortable conversation, but it's an important conversation. These are things that we need to be able to have. Even if you're having this conversation with somebody who thinks completely opposite or has different beliefs, you can still have those conversations as long as they're respectful and everyone respects the right that you're allowed to feel and think the way that you are allowed to think.
I agree. I think it's important, like Dr. Smith was saying, to separate yourself from whoever you're speaking to. Everyone is entitled to their rights and their beliefs, and just being aware of that. Really staying up to date is the best thing that you can do, and educating those around you to stay up to date. Especially, I don't know how many of you want to go into healthcare or into some sort of profession where you're working with others, but encouraging and empowering people to stay up to date and know what their rights are. And where also you are, what your rights are, where you are.
Part of what I do in the emergency department is I do sexual assault forensic care. So I am a forensic nurse. I teach it here, and I deliver that care in the hospital. And I find that many of my adolescents that I treat, so anywhere from 16 to 25, they don't know their rights. They don't know that they can come to any emergency department for any sexual reproductive health issues, whether it's sexual assault, unwanted pregnant, whatever the case may be, and get counseling. They can get medication, they can get care, and they don't have to tell their parents. And we can't tell their parents, right? It is their right, their civil rights. So if you look at the New York Civil Liberties Union website, you'll be able to learn all about the rights that you have as an adolescent. I don't want you to think that, what am I going to do? I have no way of getting this care. I don't know who to turn to. When in doubt, you can go to any emergency department and they will help you. And actually for sexual rights, it's 12 and above. So God forbid, a 12-year-old is sexually assaulted. They don't have to take that back and home. But, did anybody, when they were in the 6th grade, 7th grade, has anyone ever told them that? That they were allowed to go to a hospital without a parent? Right? If you don't know that, if the education isn't out there and the public awareness, then how would you know that you have those rights to do that? And it is safe. It's a good thing to do, to seek out the help of somebody that has that education and is willing to give you that care.
Yeah, the healthcare system is extremely complex. So I think, as healthcare providers, educating the public is the best thing that we can do, because a lot of people don't know those rights.
Yeah. Especially young people.
So what can you do to help, advocate or find out the right information? If, New York has still, I guess, more rights than other states. So what can we do to ensure that those rights stay, and, especially in an election year?
vote.
Yeah, definitely
You need to vote. You need to know your rights. You need to know the intricacies of what everyone's talking about, and then form your own opinion, your informed opinion, right? And then exercise your right to vote because it's so powerful. Because the only way to make change is if the people that are like-minded and have these, great thoughts, that they contact their congressional leaders and their local state leaders, that they inquire about these things, that they use their right to vote to be able to affect change, right? And we've definitely seen, that you can still go and vote and maybe things didn't go the way you planned. That doesn't stop your desire or your ability to be able to continue to learn about things, advocate, help a friend. Maybe you have a friend who's in a way, hey, I heard somebody speak at my school and they said this, we can help you. And I think that's the way that we do that. We have to support each other. That's the only way to do it.
I think, we also have so much information at our fingertips. It's really hard to decipher, what is evidence-based. So that there's this building here, it's a library, There's some very nice people in there, librarians. So making sure too what you're looking at is literature that is supported by evidence. Because the internet, while it's so great, really anyone can talk about anything in any way that they want without any sort of science behind it. Mm-hmm. So making sure what you're reading has a backing, and that you're getting good, solid information from reputable sources.
Absolutely.
How do you see the role of healthcare providers evolving in terms of impacting both the physical and mental well-being of our communities?
You have any thoughts on that?
I think the most important thing, as healthcare providers is, building rapport with our communities. It's, not allowing the most private aspects of our patients' care to be politicized, and really looking at the individual and what they want, and separating yourself, because that is really the basis of what we do, why we do what we do, is, providing, allowing patients to have autonomy and supporting them through that, and what their healthcare needs are. I think as healthcare develops and things in this election year keep on developing, there's going to be more of this mind-body connection, integration of physical and mental health, from a mental health person. I think that mental health is just becoming it's getting bigger and bigger in the field and more recognized. So more of that integration of wellness and treating the whole person, which is a lot of what nursing stands for, is holistic health. So I do think that is going to start, evolving more.
Yeah, I really stand by the education. I educate all of my patients. A lot of times they are unsure of what their rights are and what is available to them, or they'll just say, I don't want my parents to know that I'm here. How can we go about this? Or I wasn't going to come, but my friend made me come because they were concerned, which is a good friend, right? And once you come in, my standpoint, especially from emergency medicine, is making sure I can stabilize that patient, making sure they don't leave without the education that they need to be able to take care of themselves, giving back the autonomy, the education, and the right, and say, I want to help you how you need to be helped. Right? I can give you all my medical education and it'll just sound like a bunch of blah, 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 blah. How am I helping you help yourself? Tell me, guide me in how I can do that. So really, I think healthcare needs to be just available to the public, accepting one another, and I think we still struggle with that as a nation, and I'm sad to actually say those words, bringing people forth and just saying all the things all the reasons why you were afraid to come here and get care are irrelevant to me. I just want to take care of you the best way that you need to be taken care of, right? Has nothing to do with me, has nothing to do with anybody else but that person. So I think turning that healthcare back around to the consumer, right? That's the most important thing that we can do, so that they know, hey, I'm at this really cool NP in the ED, and I'm going to go back and see her again because she was awesome, and supporting people. And I think that's what we do as nurses. We support people. And sometimes supporting people means getting them a blanket. Sometimes it means navigating them through a difficult situation and making sure that they're safe, right? A lot of what we do is making sure that people are safe, comfortable in their own skin, comfortable to be able to ask questions, giving them an open, private audience with one person where they're not pulled in a million directions so that they can talk about their health care and their safety.
So you mentioned social media and how there's so much information out there. So what are your recommendations in terms of students navigating that, knowing what's applicable to them, and how to know, like you said, to find those resources, to find those good information, to know what their rights are, to help with advocacy, and to even navigate now as we're in an election year, to know who viewpoints you want to listen to.
I think it's like what Dr. D said, and it's just doing your research. It's okay to listen to social media or to watch videos and stuff, but that the buck doesn't stop there. So I heard this person talking about this opinion, about their opinion. They're saying that this is factual. Let me do a little bit more research and find out if this is factual, because if it is, I may feel a certain way about it. Right? So it's okay to listen to all different types of peoples and their opinions, and I respect everyone's right to have their opinions. I don't know that I necessarily hang my hat on them until I've done the research myself, because I know that I can go out there and I can look for stuff. And I found stuff that is 100% made up, and I found stuff that I'm like, wow, this is actually true. I found it. I found the resource where this came from, and it's a reputable, website or group or organization or whatever it is, and just doing your own research. I think that that's part of becoming an adult, and that's part of being able to navigate your own life in a world that is increasingly becoming challenging for a lot of people. Just do your research.
Yeah, there's a lot of national organizations for everything. So making sure that, you can look on those websites, look at the national organizations, state organizations. I actually think it's really good when you look at two completely opposite viewpoints, because then you're able to see what the two extremes are, so then you can figure out where you want to land. I think that's actually a really good thing, and it's okay for your viewpoint to change and to develop over time. And to recognize what your own biases are as well. I mean, I know as, healthcare providers, we also have to do that, is recognize what is your own bias, so then this way you can care for your patient, you can recognize that, you can own it, and then give the best care that you can. So utilizing all the resources around you, friends, TikTok, I'm a big TikTok fan, Instagram, and then of course, reputable sources as well.
So, how do you get, in terms of the election year, and there's so much going on, it's a big year, there's so many topics, so how do you even get to focus on healthcare and know, what your, the policies are? Like, how, with everything else, some of the things that happened even with Roe versus Wade was there's other policies that got overturned with it, and as a general public, we don't even know what that means. We don't know the implications, and especially for a younger audience. I mean, unless you're faced with a reproductive issue, you might have heard about Roe versus Wade, but didn't pay much attention to it until all of a sudden you're faced with it.
Right. I think part of it is that people don't know what they don't know until there comes a time when they need to know it. And now all of a sudden they're like, I heard about this, but I didn't know it was going to affect me, and now it's affecting me, and I don't know where to go from there. A lot of .gov websites have a list of the policies, and I'm not saying that necessarily I agree or disagree with them. However, the actual written policies are available for you to kind of sift through a lot of language, and a lot of it is just kind of language that's in there, parcel it out, digest it, and how are you comprehending this? And then how does it affect me? When would I ever need this in my life, right? And of course, always being, personally, I always advocate for people being upstanders, right? And if we're upstanders to friends of ours that maybe, don't think the way that we do, learning about it, having that discussion. Why is this important to me? you know, and when something's not important to you, maybe you don't do your due diligence in looking through it, and same, that's just human nature. But making sure that as you navigate school and your careers and where you want to land in life, that you're doing your due diligence to know everything about it, or at least have an idea and then seek further clarification. And it could be from a peer or from a professor or from your family.
Also, watching the debates. That's a good way to know about policies and things that the candidates stand for. Looking, you know, where we are right now. Where are we? We're in like Hempstead, Uniondale-ish area. So looking at what are things on like your local ballots, or if maybe you're getting an absentee ballot from where you hail from, looking like what is going to be on the ballot. So this way you can properly educate yourself about those issues. So taking more of a, you know, a proactive sort of approach so you can prepare for when you do vote.
So in an election year, as healthcare professionals, how do you navigate policy changes while maintaining professional integrity?
I think just like we're advocating to you, I constantly have to look things up, make sure I'm saying the right thing, educating myself about the different things that might affect patients. You know, if I just pluck out of the air like medication costs, you know, not every American has a plan that will cover medications. And we were actually just talking about this over at the School of Nursing, and Ozempic, which is like, you know, now this big, it's weight loss, but it also does heart failure, and it's all these off-label uses. If you don't have insurance and your doctor prescribes it, it's $800, one syringe that covers you 1 month. I don't know of many people in this room, including sitting up here, that would readily be like, oh, $800, let me pull my wallet out, without having a hardship, without thinking about the rest of your bills. How am I going to feed my family, right? So we see a lot of people that are unable, I'm sure you see this in mental health as well, they can't afford their medication. And you see this a lot in the elderly, or people in Black and brown communities, or, you know, just people that live below the poverty line. And they'll say, oh, I have the medication, but I've been breaking it off in little chunks so that it will last me a longer time, right? So, and then they're not being treated appropriately. Then they end up having rebound trips to the hospital because they have to be hospitalized. And it's just this kind of giant Ferris wheel that goes around and around, and it's, you know, doesn't go anywhere.
I agree. I also think, you know, as a healthcare provider, just remaining objective, stating facts, treating the person, that is what is probably the best thing to maintain professional integrity, not getting too involved in terms of the, you know, political stances, but treating the person right in front of me, no matter what my political belief is. This is the situation, and I need to do what I know from my medical knowledge, what this patient needs right now and what they want right now. Yeah. So I think that is probably one of the best ways to maintain your integrity, which is also going to be, like I've said before, is recognizing what is your own bias. What are your beliefs? Because not everyone that you encounter is going to have that belief, and that's okay. You know, I think that's actually one of the beauty of our country, is that we are all entitled to our own opinion and to our own belief. That's what democracy is.
Yeah, absolutely. And giving everyone the grace to allow themselves to grow within that, I think that's important. And also knowing, for me personally, I love to know all the resources that are available. So if I have a patient say, how much is that going to cost because I don't have any health insurance or I don't have any prescription coverage, to say, oh, I know a great plan. I print you out a coupon. This was supposed to be $50, but this coupon entitles it to you for $5. Are you able to cover that? Is there some way we can help you? Maybe we can dispense something from the hospital to at least get you through until we can get you on a plan. And so I think personally, I try to find out as many resources that are still available, still around, so that people know. And most people are uneducated about this stuff. They just don't know it's out there.
So you talked about prescription costs. That goes in line with my next question. We also have a huge immigration population now, especially in New York. So we're struggling with trying to provide health care, right, to our patients who do have, let's say, the means or do have insurance. How do you, especially both of you working in the ED, navigate this? And how, this has also come up in the recent debates. Talks about the debates. That was a big topic between Harris and Trump in the last debate. They talked about the immigration. They did talk about abortion in terms of in vitro fertilization, how they are separating those things out. But how do we as healthcare professionals deal with that in order to provide good care for our patients?
I deal with a lot of farm migrant workers when I work out east, just this past weekend, and we have a lot of families that come in. They don't have a pediatrician. And if you're from America, it's like a known thing. Your children have to have pediatricians. They have to follow up with all their care. So I think personally, how I approach it is trying to, first of all, making sure that I use a translator phone because my Spanish is terrible, and so that they have good understanding, and also being very respectful of people from different cultures. Would never profess to know everything about every culture, so I ask a lot of questions. I don't want to insult, and I want to be helpful, so it behooves me to ask questions and then educate and then try to get them. And a lot of it is just that, they come here and they're afraid. They're afraid to seek medical care. We have a lot of humanly trafficked people on Long Island. I know that probably sounds strange to you, but it's a very large hub in the United States is Long Island, specifically the I-95 corridor. And being able to recognize when somebody is in distress, when somebody might need a little bit more sensitive care, asking the right questions and giving the privacy that each human being deserves to be able to speak about what is affecting them. I think that is part of it.
I was going to say providing culturally competent care. So like Dr. Smith said, I also, where I work, see a lot of individuals from the migrant shelters, and just, some of their stories are heartbreaking. They're very eye-opening. But giving them the time to tell that story, if they so desire. I work in psychiatry, so usually people are telling me a lot of information. That's why they're seeing me. So providing that culturally competent care and, understanding that their lived experience is not my lived experience, and recognizing that. Just and what do they need in this moment. I've helped individuals coordinate who wanted to go back to where they were, like they personally wanted to return and couldn't navigate, how to get home, and so helping them with that was something we helped them with in the emergency room. That was what their need was. So just meeting them where they're at. I think that's a hard thing when you're in a health profession, is meeting someone as well where they're at, and where they're at may not be where you think they should be at or what you believe they should be at, especially when we're talking about like substance use, for instance. That's a good example. Is ideally people should not hopefully use opioids, misuse opioids, but that might not be where someone is at in terms of what you can provide for them. And it's the same thing when we're talking about individuals who, are homeless, for example. They might not want a shelter, so what can you do for them in this moment to help them,
I think a little kindness goes a long way too, not just in healthcare, but just in life in general, as we navigate relationships in schools, in professional areas, having a little thoughtfulness, taking a step back and listening, which I think some people are very good at and other people are not so good at. They hear you, right? They hear the sound, but are they comprehending and listening to what you're saying, and vice versa? Because that's the only way that we can truly help people and get to know them, is by truly sitting down, listening, making that eye contact. I feel like it's a little bit of a lost art, so that's something that I think is really important. And just always remember, I may not necessarily agree or understand where this person is coming from, but showing a little bit of kindness goes a very, very long way.
Yeah. Before I leave a room, I always ask someone, like, what can I do to help you today? Like, what can I help you with right now? Most of the people that I see, a lot of times they're brought in there against their will, and no one wants to see me. But I'm like, well, what can I do right now in this moment to help you? And sometimes it's like, can you shut the light off? Like, absolutely, I will do that for you.
So just to go back a little bit about your own personal feelings and your challenges that we face as healthcare professionals, you mentioned that in some states when Roe versus Wade got turned over that you couldn't practice. So we're lucky in New York in that we still have a lot of rights. I know when I first heard about Roe versus Wade, I was shocked. I mean, this was something that we got in the 1960s. Women went out and fought for reproductive rights. They lobbied, they, protested, they did a lot, and we came a huge way. And when that got overturned, it was like, wow, we're going backwards. So as a healthcare professional, how do you navigate, dealing with what is allowed to us and what our own personal beliefs are in terms of doing no harm to patients? Because we're all here to care for people.
Yeah. I think like what Dr. D was saying earlier, separating myself, my own personal thoughts, they are irrelevant. I need to just give forth my kindness, my education, and offer services that are available, that are legal. When Roe v. Wade was overturned, I actually cried. Mm-hmm. I was really upset. I do teach women's health within the nurse practitioner program, and I see a lot of these patients in the emergency department. And, I knew in my heart that this was going to be a very bad road for us. So, keeping objective and keeping the kind of crying human side of me out of it, just saying, these are the facts. This is what's happening with you. These are your options. I always try to give people options, and some of them are not great options, but as best as I can navigate the system, I will help them understand and then try to support those patients that need these services. And, it's tough. It's tough. It's tough not to take it home and to feel like, remember that patient. I wonder what happened to them. I hope they're okay.
Yeah, there's a term for that. Non-directive counseling is the actual term. So, I don't know if anyone wants to be a genetic counselor, but that is a term, is providing non-directive, what you're describing as non-directive counseling, is here's the facts, here's your options, and I'll support you in not giving. It's very hard to not give your own personal opinion, but that's kind of the art of therapy, is you actually do the opposite. You do not give any advice, is you allow people to make their own decisions and support them in that.
Yeah, I think part of like losing something like Roe v. Wade and some of the other policies that were nebulous at the time is, like figuring out how we go forward and then giving the options to your patients and to your friends and family and all the other people that are going to ask for advice, to my children, and being as unbiased as possible. It's hard. It's hard to do that, especially when you care about somebody. It's really hard to do that if they're in your family or they're your friend. You want them to think the way you do. You want them to listen to you. But it's really important to take that step back and be as neutral as possible. And I have people ask me all the time, what would you do if I was your child?
All the time.
Yeah, but
All
you're not
the
my
time.
child. I didn't give birth to you. You are my patient. And my job is to take care of you as best as I can within the confines of what you need at this moment, not my opinions on what I would do for my own child. I think that there's a big difference.
Thank you. Dr. Smith, would you like to offer any final thoughts and takeaways from our discussion?
Please vote. Please learn about your government and about the different ideologies that are out there, and make your own way. You're smart. You're here. You have access to education. You're fortunate. And then be that advocate, be that upstander for somebody else that maybe doesn't have the opportunity to have the education that you have.
Dr. D?
My turn. I concur. I also think, vote, definitely educate yourself. I think that this generation has been really good at voicing their opinion, at breaking stigma, at really showing what the issues are and continuing to do that, and to not be afraid to use your voice or whatever social media means you have to spread awareness. So that's what I would leave this with.
Yeah, I agree. I think a lot of times, especially in New York, if you guys are from New York, we think, oh, well, we don't need to vote, our vote doesn't matter, everyone else is voting. But it really does. A lot of these things get, done at a level much higher than us, but we still do have a voice. And making that small change, even knowing what's going on locally, as Dr. Smith said before, is really important, because just even small, like micro changes can eventually lead to really big macro changes. And I think in this election year, again, there's so many topics and there's so many things that people are arguing about and discussing, but our healthcare shouldn't be like sent to the side. We should be really aware of what our rights are and what we take for granted as our rights, especially in New York, and we wouldn't want to lose those freedoms. Anything else you guys want to add?
Any questions?
I'll open it up to questions.
Thoughts, concerns, comments? I say that to my
Yeah,
students. all the time.
I say political views.
Yeah.
So in one of my classes,
There's a microphone.
can you hear me okay?
Yeah.
Absolutely.
Okay. So in one of my health classes, one of my professors was talking about kind of the issue with telehealth and how that's now being phased out officially. And how do you think, I mentioned earlier in the presentation, you mentioned kind of how that affects like rural, more, communities that are a lot smaller. So how do you think like moving forward, that being taken away will affect those communities?
So I think it depends what you're talking about. I don't know what your professor was talking about with being phased out. I mean, there certainly are, different stances since COVID. With COVID, they were allowing, controlled substances to be prescribed without seeing a patient. Whereas you actually do need to see someone now that the public emergency is over. But I think that the telehealth that people need is still going to be happening. I think a lot of it depends on reimbursement rates and what's going to happen in this election. If telehealth is phased out more, I think it's going to be a really big struggle for these communities. But hopefully there's things as well like mobile units. That has become very popular. Now we have apps as well as a means to healthcare. So I'm not sure what they were discussing in the class specifically, but from what I've heard is telehealth is just becoming larger and larger as a means for people. I mean, most of the people that, I know at the local clinic, where my hospital's affiliated, is they don't even go in person anymore. They talk to people over the phone. So it's really provided an avenue for people to just have healthcare right at their fingertips. I think that, if anything, we need to be providing people with more means to do that, because then it becomes an issue when you don't have a phone, especially with an older generation, too. They were like, I don't know how to use this thing.
True. Yeah, I agree. I think out of context, it's hard to comment upon that. But this summer, I piloted and developed within Northwell Health a TeleSafe program. So SAFE stands for Sexual Assault Forensic Examiner. And our thought process was not every single hospital offers these services, but legally they're supposed to. And so we were thinking, well, maybe there won't be somebody on site, but if as a safe provider, if I can dial in to give counseling to that patient, or help the healthcare providers that don't know how to do this type of exam through the exam so that that patient gets the best care that's available to them, right? They shouldn't be penalized because somebody there didn't take a course. That doesn't make any sense to me. So I think it's incredibly important to advocate for these things, not only for rural places, because we're privileged. We live down here in this lower state, 5 boroughs, Long Island. We're very populous. We have a lot of things. Now, I drove up past Albany, which I was like, this is a different planet, and it's still in New York. Right? If anyone's from upstate, they're probably like she's silly, but. Anything over the Bronx to me, by the way, is the country. But so, if you think about that, and I was like, as I was driving, I was like, I've been driving for a long time. There's nothing out here, right? And so if somebody's sick or somebody's been sexually assaulted or they're being abused in their home, child abuse, intimate partner violence, all these different things, where do they go? Who's keeping an eye on these patients, or at least giving them the ability to say, I am so far from a hospital, but at least I can call someone and get advice or help, or they can get help to me. So, maybe some telehealth services might be going away. I think that there are some that are very, very useful, and I would advocate for it to stay.
So I think some of the problem comes back to cost and reimbursement. So during COVID, we were able to provide these services essentially for free. So my specialty is oncology. And so we have one like sort of hub, which is in New Hyde Park, that's not very easily accessible to people who live out in Suffolk. So we do provide telehealth services for those patients. We get around it to some degree. Sometimes we code it so that the patient doesn't get charged. You can kind of say it's a telephone visit instead of a telehealth. Other times we do have to charge the patient. Hopefully they'll be picked, it'll be covered by their insurance company. But it comes down to, unfortunately, it comes down to money. And, we really would love to say that healthcare is, strictly about the patient, but it is unfortunately a business too. So as providers, we try to do whatever we can to kind of work around these sort of, I guess, handicaps, if you will. But yes, there is a role for telehealth. It is just not as readily available as it was during COVID because of restrictions that have come into place. The other thing that Dr. D mentioned is access, right? So some patients don't have, an iPad or a cell phone that you can have telehealth on, so that becomes an issue. So it's access to care.
Yeah.
Thank you.
You're
Yeah.
welcome. Anybody else? Uh-oh, she's coming for you.
Man.
So I brought my class here today from the sociology of gender. There's a sociology of gender class specifically because you had a lot of those topics that we're talking about. And it's only the first few weeks, but one question that I wanted to ask is, institutions such as healthcare typically reinforce traditional gender roles. So I'm wondering, how you've seen any kind of, clearly we have women who are here representing, yes, as doctors, which is wonderful, but the role in particular to mitigate issues of inequality in the overall health experience, in particular for anybody within the LGBTQAI plus community, what kind of things are being done that you see kind of changes, if you will, in the last 5 to 8 years maybe in your practices to help mitigate those experiences for people, and also kind of straying away from the typical gender norms and, in practice in healthcare. If you could just speak a little bit to that.
I'd say education.
I was going to say the same thing.
That is the number one thing that has taken place, is providing education on the gender spectrum, if you will, of, to everybody. In terms of, I work in psychiatry, so in terms of our recognition of the gender experience, we are very, very educated because of the population that we serve, which is everybody. And unfortunately, some of the things that have happened to individuals who may not fit those typical gender roles that have had bad things happen to them. Mm-hmm. So I think it's, providing education, giving education. I know in my personal practice, I say, pregnant individuals. I really try to say that as much as I can, because not every single person is a pregnant woman. I teach genetics. I recently was telling my class, I don't use mother, father, sperm, the individual sperm parent and egg parent. I think just trying to use those terms and familiarize yourself and pass that on is probably what I've seen most in healthcare. I know that, at Northwell, they're very aware and very educated. Mm-hmm. They have a whole center devoted to transgender care and gender affirming care.
Yeah, I think education of the providers, not even so much, honestly, if I sat amongst you and we all just had a frank conversation, you would probably be teaching me some stuff too, which I always appreciate. But I think that as providers, I do a lot of education within Northwell to other providers about how language matters and how we approach people. And it's difficult, right? Because we are we are socialized using these gender norms, using these pronouns, and even for weird stuff. Like I was looking at a catalog and it said boyfriend towel. And no matter how much I read the description, I didn't understand what made it a boyfriend towel. I don't even know what that means. Is the towel your boyfriend? Why is it a boy? I don't understand. I didn't understand the whole thing. And I was literally staring at this thing and I'm like, this is the dumbest thing I've ever seen, right? So we put gender to strange objects and then we hold other people accountable to those kind of gender norms, and I don't think that's appropriate. When I teach, I really try to teach language and how that affects people. And I think that right now Northwell's on this big thing where they're teaching all the doctors, it's this mandatory course. And I always laugh and say it's teaching the doctors how to be nurses because it's like, hi, be nice to your patients and don't say stupid things, right? And so when I introduce myself to any of my patients, age, gender, it doesn't matter. I tell everyone, my name is Amy, I'm a nurse practitioner, and my pronouns are she and her. What would you like to be called? Right? It's a simple sentence, but it opens the door and it tells them that anybody that's with me, you're safe with me. I've got your back. I'm not going to let anything bad happen to you here. And if something does, I'm going to fix it. Right? And I think that if we collectively do this, and pass this kind of tradition down and this type of education, then more and more they'll be accepting in practices and not, even in our EMRs, which is our medical record, it's like male, female, or other. And I'm like, well, that's rude. It's a computer program. You can literally make this say anything you want or nothing, right? We haven't even spoken to this person. How do we know what it is that they would like to tell us? We don't even know that. We don't know them. So I think that's important. It's these little changes that will change the mindset of other people. And I teach in one of my SANE courses, I talk about, I give an example, and I'm like, what is cisgendered? And depending on where I am teaching this, some people will know the answer and some people don't. I never have a problem when I have my younger nurses. They're all very, very well versed in language and how that affects people. But when I'm in a group of older nurses, such as myself, they look at me and they're like, I've never heard that word before in my life. Right? So this is just about changing language and opening people up to different language and saying, you don't continuously misgender a person. That is rude. It's like a verbal assault. Right? And they're not going to trust you. They're not going to want to hear anything else you have to say, and I don't blame them. I would feel the same way. So I think educating our providers, and I think we do a good job of it in our program, shameless plug. But we, have program days and we work with lots of different communities and we talk about these things and how as providers we can change the landscape of how we take care of human beings. That all deserve, they're sentient human beings, they deserve the respect.
I also think, like you said, we're women sitting up here, so, we identify that way anyway, but I think even within healthcare that's changing. The idea of it being just men or just white men, for instance, is going away. We're seeing all, genders, races, there's a difference, right? It used to be that the female was the nurse, and that's not the case anymore. You're seeing them in all specialties, medical providers. So I think our landscape is slowly changing. Again, like I said earlier, we've said a lot, we're kind of lucky within New York. I know that's not the case everywhere. But I think it's just so important to be educated. I see it a lot in the oncologic, community, because you can't just because someone, says they identify one way, we still have to recognize that maybe they were born somewhere else and we have to remember that they have, we need to take care of them holistically no matter which way they identify. So I think we're all changing and we're becoming more aware of it and being more inclusive in recognizing that there's, a spectrum.
Absolutely. I think representation is important. And in healthcare, it's really important. It's really important that we have representation from anyone that feels any way, that identifies any way, that whatever the case may be, we need that representation. So, because how is your patient going to feel comfortable if they feel that there's no way you're going to understand me, because you don't know my culture, you don't know my background, you don't know what my struggles. And so, obviously encouraging people that feel this way if they go into healthcare or into social work or into, like being sociologists or whatever the case is going to be, I think that that's really important is thinking about representation and how you can support your communities and teach others about your communities. Any other questions?
Looking from more of a public policy viewpoint, what do you think could be done in the future, like beyond maybe just this year, or like, because I'm looking to going into some sort of public service place, what do you think could help mitigate the problems that are involved with getting people the health care they need, like both affordably and like accessibly?
That's a
tough question.
That's a tough question. The first thing I thought of was looking out at the audience.
I was like, you
are the answer,
You
right?
are the future. Isn't there a song? The children are our future.
We need your education. We need your viewpoints. I'm not of your generation, right? So as much as I try from my end, I rely on so my daughter's in your generation, and so she schools me about a lot of stuff, and I love that, because how else would I learn? How else can we affect change if we don't have the voices, your voices, right? Educating people. It doesn't have to be in anger. It doesn't have to be in angst. It doesn't have to be, us against them. The way we can approach it is getting together and sharing of knowledge and ideas, and then brainstorming together to be able to make this kind of fair, equitable situation, especially in healthcare, so that everybody has access and nobody's left behind or out, based on anything, and sometimes based on nothing, right? So it's a very tough question.
I think it's lobbying. It's really trying to get your voice out there. We look at other countries that have universal health care. There's pros and cons to that. For instance, in Canada, with universal health care, lots of times people end up coming here because they're on a list to get surgery, and here you can pay for it and you can get it. So there's pros and cons to these things. I think what's nice is I believe England has universal health care, but they also have private health care that if you can afford it, you can pay into it. I think we just need to keep talking and keep lobbying, because there shouldn't be a two-tiered system. Healthcare shouldn't be a right. It should just be what we do. We should be able to provide that care for people, because no matter what, you should be able to have the proper care that you need, or be able to afford the prescription medications that you need. There's a lot of discussion right now in terms, like we were talking about Ozempic, about lowering the costs, because in other countries, they're not paying what we're paying for these medications.
It's disgusting.
So these conversations are happening. Again, I think like you said, it's all of us getting out there and lobbying and advocating for it, and making it a conversation that is brought to people's attention, so that they know that this affects everybody. Right now, again, Ozempic, we think about it only in terms of weight loss, but it's been proven to make huge strides in a lot of chronic diseases, and it is really impactful. So it's just making people aware of it.
Yeah, we have a problem with big pharma in this country, and they control all these things, and so they can set any costs that they want, and that seriously impacts the public. I wish I had $800 sitting in my bag for just free use to do whatever I wanted to do, or to pay for medication, but most people can't say that, like the rest of us, as opposed to maybe 1% of the nation that can do that. So somebody like you getting their education, wanting to go into some sort of public service, or maybe it turns into a political arena thing where you're a lobbyist or an advocate or whatever the case may be, that's super important. We have to keep it going. We can't just say, well, this is what they decided and we're just going to stop right here and be accepting of it. That's not how our country was formed, right? Our country was formed to be a melting pot, to have the right to be able to speak your opinion and make it a thing, normalize it, right? Find like-minded individuals that can help change the face of how this is. I wish I had ideas. I wish I had ideas to fix it all because I like to fix things. It's so complicated. And I really wish it were not the case.
Maybe if I could pick up on that excellent policy question. And just implementation, which you brought up earlier when you spoke about that middle schoolers can go to the ER for treatment for certain times, and they don't need parental approval, which that was actually news to me, and I feel like I follow health policies reasonably closely in political science, but I don't think that's well known, and I'm also curious about how that actually works in practice, because anyone I've spoken with, anytime anyone speaks about the ER, they talk about all the paperwork you have to do and and so it's difficult, there are pieces here, how would a small child get to the ER, right? How they kind of hard to do it without some adult
Help.
support. But is that, how does that work? If you can just speak to that in practice, or how that works in practice, or more generally, the challenges of kind of getting information out there.
Yeah, so a really reputable, excellent source is the New York Civil Liberties Union. If you go on their website, all of their information is free. They will send you booklets, full booklets with the laws regarding adolescents, teenagers and their rights, sexual reproductive rights, right? How to become emancipated, what would happen if you were to become emancipated. But in terms of sexual reproductive rights, it is tremendous policy about this. 12 and above in New York. Now that will vary with state. So obviously you have to know your local laws. Any sexual reproductive health, they can come to any emergency department and for free, they will get that care. We will help them get through the paperwork. We will help them get the medications that they need, right? And the follow-up care, right? We don't bill them. They don't, an EOB, which is an explanation of benefits, does not go to their parents, right? Because, some people will tell me, I think that's horrible. As a parent, I want to know everything that my child is doing. Okay, so also as a parent and as an educated healthcare provider, I can tell you, you 100% do not know everything your child is doing, period. Are kids having sex willingly and of their own free will? 100%. So what is better, to withhold healthcare from them, whether they want it willingly or that they have a situation that is a dangerous situation? Is that better? Or is it better to offer these services so that we keep them safe, healthy, and we have the moment to educate them about their rights and about how they can get health care? That's more important than having that parental control. I'm probably a little bit different of a parent because from the time my children were young, they had a very weird language upbringing because I did not withhold words that are important, right? Body parts. I don't want, strange, acronyms or fancy words, like my cookie or my, I don't know. Insert weird language here. I need to know. Somebody is hurting my child. I want to know what is happening. I want them to know that they can come to me. And if they don't feel comfortable with me, I'm going to tell them the resources that are available to them. That's important. That's how we give all of our young people autonomy and the right to decide their own health care, right? If a 12-year-old has been sexually assaulted, and I wish I could say that I haven't had to care for these children, but I have. I need to talk to them like an adult. I need to tell them what is their right, what I can do for them, how I can help them. Because otherwise they're going to go home and they're not going to tell anyone. Now we've got childhood trauma. We've got, all these terrible things that they're going to take into their adulthood, right? And maybe they start self-medicating and they start, taking drugs that they didn't really think that they were going to do, but they need to self-medicate because they're hurting inside. Then comes Dr. D to come and help them navigate those strong feelings, those emotions, those fears, right? So I think that it's important that we have these. So New York Civil Liberties Union, VAWA, which is the Violence Against Women Act, that was actually instituted when our now President Biden was a congressman. And this is about women's and those identifying as women's, their rights, right? So that they know where they can go for help, how they can help themselves, and not to feel alone. Thank you. Any other questions? Oh, it's exciting.
Hi. So, in terms of the upcoming election, I know that Donald Trump has been very clear on his position and his feelings on gender-affirming care for transgender individuals, especially children. But we've also seen under the Biden-Harris administration a rather steady decline in access to this type of care. So I was wondering what you feel the implications of the upcoming election could be and the extent of those implications on gender-affirming care for trans individuals.
I'm worried,
Very
as
worried.
we should all be worried, because it's a very slippery slope. And, you know, under the current administration, as things are declining in that way, I feel like it's almost like quietly declining, like it's not very well known, so thank you for bringing that out. Again, when we were talking about healthcare being a business, unfortunately, politics are kind of the same, right? So I think that when money is at stake, they're going to pull services from what they consider marginalized people. And that's a problem. I think the fact that we as a nation still have groups that we silo into groups and call them marginalized, I don't know that that's the way they feel. And we shouldn't be treating people that way. So now you've got this intersectionality where it's like, it's that slippery slope or that domino effect where it's just going to keep going, and then everyone just forgets, or they think people forget, right? And they, you know, bells and whistles over here so that you're not paying attention to what's happening here. So as a healthcare provider, I feel like keeping this loud and proud and open and saying, no, we're going to talk about this. This is an issue. And as a healthcare provider, how do I educate myself so that I'm giving the appropriate care, right? And so when I ask sort of surgical and medical history, I always preface it by saying, I'm only asking you so that I'm giving you the appropriate care, right? I'm not asking for morbid curiosity. Your life is your life. How can I help you, and how can I not hurt you? And the only way I can do that is if I know kind of where you are in your medical care. And then if you're stuck or you need something else, I know exactly the place where I can send you that can help you, right? So keeping that out there, offering those services, I think that's important.
I think it's also, like I said, it is voting, it's educating. You know, we spoke a lot about Roe versus Wade, and it truly was heartbreaking because that was so monumental. First of all, when we got it in healthcare history in this country, and when we lost it, because I think once we lost that, we did start to see a lot of this slippery slope, and it gets buried. You know, there's so many other things that kind of get, you know, taken over or spoken about loud enough. So then all of a sudden these things get taken away from people slowly, and you turn around and you're like, you know, how did that happen? And again, you know, we are lucky that we're in New York, but it's just one place, right? So we need to make sure that this is being, you know, throughout our country, that people have the rights and that they have access to care. You know, whatever our personal beliefs are, it shouldn't impact, you know, whatever else somebody wants as healthcare professionals. Unfortunately, though, we do have to abide by the law, and this is, again, where we need people to go out there and to advocate and to vote. You know, when there was the AIDS epidemic, people didn't want to take care of those patients, right? And then we learned and we got educated, and now that's not a thing. So not saying this is on the same level, but it's just the lack sometimes of education and, you know, trying to understand where that person's coming from. You know, to talk about trans and what they feel, you know, it's sitting there and educating ourselves on what those people's beliefs are. And like we were saying, is to be open-minded, have a discussion, know where that patient's coming from, knowing what resources we can give them, you know, so that they're comfortable to have that conversation. But it's really just getting out there. You know, unfortunately, it wasn't something that a lot of, you know, we were really good at it at one point in our history, and then young people stopped voting, and I really think we're getting back to it, but it's just so important.
Thank you.
Thank you. I wish I had the answers to solve all the problems. I really do, but I would make exponentially more money than I do right now. I'm just going to throw that out there. Any other questions before we wrap up? Thank you so much for coming and listening and participating. I really appreciate it.